So next, arthrocentesis. What is arthrocentesis, guys? Divide the word. What is arthrocentesis?
Aspiration of fluid from joint.
Perfect. So what is your keyword? Arthro. Wherever you see arthro, you need to understand patient is telling us about joint. Okay. Arthrocentesis. Aspiration and or injection. Intermediate, sorry. So this one is, yeah, small joint. Okay. Intermediate joint as well as major joint. Okay. So here we have few important guidelines we need to understand. 20600. Arthrocentesis, aspiration and or injection, small joint or bursa. Fingers or toes. Without ultrasound guidance, with ultrasound guidance. Okay. So they are telling if the patient performs arthrocentesis on the fingers or toes, you need to use 20600. Okay. And you need to check the operating report for ultrasound guidance. If the patient does not use ultrasound guidance, 20600. If the patient uses the ultrasound, you will use 20604. Okay. Next, we have 20605. Arthrocentesis, aspiration and or injection, intermediate joint or bursa. So how do you identify intermediate joint or bursa? Using these keywords. TMJ joint, temporomandibular joint, AC joint, acromioclavicular joint, wrist, elbow or ankle, olecranon bursa. Without ultrasound guidance, with ultrasound guidance. Simple. Okay. Next, these are major joints. 20610. Major joints include shoulder, hip, knee, subacromial bursa. Without ultrasound guidance, with ultrasound guidance. Simple. Okay. So the most confusing part here is how do you code if the patient performs both aspiration and injection at the same time? How do you code, guys? So for example, in the operating report, if you see, so I have performed finger aspiration first, then injection. Will you code one code or two codes?
One
Without
code.
imaging guidance.
One code.
One code.
Yeah. How do you decide one code? What is your keyword here?
Description itself it was mentioned and or injection.
Yeah. So yeah, that is correct. So description itself they are mentioning if the patient perform both aspiration injection also you can use 20600. Okay. If the patient performs any one among these two also you can use 20600. Okay. If the patient uses only aspiration, okay, you will use 20600. If the patient performs only injection, you will use 20600. Okay. So like that you need to code. So as these codes are having the code description of without ultrasound guidance, with ultrasound guidance, you can't code ultrasound guidance along with 20600 to 20611. Why means ultrasound guidance is defaultly included in these codes. Okay. But if the patient performs any other guidance other than ultrasound guidance like fluoroscopy, MR or CT guidance, you can code them separately. Okay. So that is the guideline. Okay. For example, patient has performed like arthrocentesis and injection on the AC joint using the ultra like fluoroscopy. How do we code, guys? Which codes you will use?
206 fluoroscopy we will 7700.
20605
And
and
yes, and
77002.
yeah, perfect. Okay. So fluoroscopy correct, flow 77002. So we'll see practically. So 20605. For example, right side only. Oh, sorry, yeah, no problem. We can change here. What is the ultrasound guide? Sorry, fluoroscopy guide code.
77002.
Yeah, 77002. Now we will remove this one. So now we'll see whether do we get any edit or not. See here, there is no edit. Okay, just they are telling us to use the 50 modifier here. Okay, so there is no edit here. Means, so what is important whenever you code these procedures, whenever you code arthrocentesis, first of all you need to check where is the location of the injection, whether it is in the muscle or joint. First keyword. Okay. Next, you need to check whether patient is performing only aspiration or only injection or both. Okay. Next, you need to check what type of joint is it. Small joint or intermediate joint or major joint. Okay. Next, you need to check imaging guidance. So with ultrasound guidance or without ultrasound guidance. Okay. If it is without ultrasound guidance or but you see imaging guidance, that time you need to check what type of imaging guidance. If it is fluoroscopy, you need to use 77002. If it is CT, you will use 77012. If it is MR guidance, you will use 77021. Okay. So these are very, very important for your interview procedures, interviews also. So tell me now, how do you code arthrocentesis? So for example, in the interview, they may ask you, how do you code arthrocentesis? So tell me the keywords once again. So if you repeat, you can remember. So go ahead, anyone? Hello?
First, we need to check whether joint or muscle involved. If joint is involved, we have to check for injection or aspiration, and without ultrasound or with ultrasound.
Yes.
Without ultrasound, if imaging is performed like fluoro, CT or MRI, then we need to report that specific code.
Yeah. So most important point you missed.
Small or intermediate.
Yeah, small
Perfect.
intermediate.
Yeah, that is very important. So just for that one, you need to understand type of joint. Okay. So type of joint you need to check. So that is very, very important. Okay, guys. So like that, these are the nearly 7 to 8 keywords you need to use while using arthrocentesis CPT codes. For example, patient has performed arthrocentesis of the olecranon bursa. How do you code? How do you code, guys?
2060.
2060.
0605.
What about ultrasound?
It is not mentioned.
Perfect. So
2060.
ultrasound is, yeah, correct. So if the nothing is mentioned, you can't code related to imaging guidance. Okay. Now one more example. So patient has performed arthrocentesis on left shoulder as well as right shoulder. So left shoulder without imaging guidance, right shoulder with imaging guidance. How do we code? So don't worry, we'll check practically. Okay. So 20605 right side. Okay. Next 20606. So which side it is? Left side. See here. Okay. So they are telling if you are reporting a bilateral procedure, append modifier 50. Okay. So now we don't have any like edit here, but if your encoder, if you face any edit, so how do you get rid of this edit? 51 modifier is for only for physician coding, not for facility coding. For facility, you need to use which modifier, guys?
50 modifier.
59.
Yeah, 59 or XS are those variants based on your clients. Okay. So like that, you need to use separate structure. So right side is different, left side is different, correct? Okay, so like that you need to use. This is for olecranon and bursa, for example, or AC joint, wrist or elbow or ankle. These are the intermediate joints. So for example, if you append 51 modifier, if you are coding for physician, you don't have any edit here, correct? So our codify is based on physician edit, not based on the facility edits. That you need to remember. Okay, so simple. So these are the important questions you need to remember while going for interviews. So these are the, whenever like you watch this video again, just you can note down in your notes. So what are the keywords to remember while coding arthrocentesis? These are very, very important for interviews. That's why. Okay. Next, this is the imaging related to arthrocentesis. See, this is the what do you call? So arthrocentesis, aspiration and or injection of major joint or bursa. So this is the hip joint basically. Articular capsule of hip joint. So this is the capsule of the hip. So here physician is injecting the medication. Okay. These are